Hi again. This is topic number two, hand hygiene, which is very popular nowadays. So we'll be talking about hand hygiene in quite details. All right. Specific learning outcomes for this topic is one, describe the scientific evidence base supporting the effectiveness of hand hygiene in preventing infection. Number two, discuss the indications for hand hygiene and its types. Number three, discuss appropriate use of hand hygiene product. Okay, so there are three specific learning outcomes. Sorry, there's another one. Demonstrate an effective hand hygiene technique. So this is the one that we are going to concentrate more. Okay, so I'll be showing you some videos as well. Okay, so clean hands are the single most important factor in preventing the spread of pathogens and antibiotic resistance in healthcare settings. You have learned about the chain of infection. So this is one of the way of us to break the chain of infection, okay? Because hands is very well known to be the transmitter for all infectious diseases, okay? All right, so let's move on. All right, so what this photo or diagram showing is we have a substance that we put on the hands, and this substance will glow when we put our hands under UV lights, okay? So what we did was we asked the person to put on this substance, which is a powder, right? So just to cover the whole hands, all right? So we wanted to know whether when we wash our hands, would the washing technique that we use would eradicate the powder which depicts the germ, okay? So let's look at the top left diagram before washing. So you can see under the UV light, it shows a bright light, okay, a bright blue light. So that means the powder is still on the hand. All right. And then number two, rinse and shake. This is what you usually do when you go to the cafeteria or you want to use your hand to eat. So you go to the sink and you wash your hands. So this is usually what you do, rinse and shake. So you rinse your hands and you shake it. And you can still see abundance of the powder or the light color still blue. And then number three is 6 seconds no soap. So this patient, this person, wash it, his or her hand, or probably her hand, under water for 6 seconds without soap. Okay, so you can still see a lot of powder there. All right. Number four on the bottom left, 6 seconds with soap, you can see a marked reduction of the powder, where you can see that it's darker, a lot darker now under the UV light. And then there is another one, the fifth one, 15 seconds with soap, a little bit longer washing. You can see again the blue light is starting to diminish. And then the last one, number six, is 30 seconds with soap. You can see most of the blue light are gone. Okay, so you can compare these six photos. Okay, so it just shows you that use soap, number one, and take a longer time to wash your hand. Do not go over 1 or 2 seconds only, or 3 seconds only, right? So 15 to 30 seconds could be more sufficient rather than just rinse, okay? So we will see more details later, okay? All right, what are the aspects in the hand hygiene? Um, Water temperature does not appear to be a critical factor. So anything with water, clean water that you can wash your hands. If you use warm water or you use cold water, doesn't really matter. okay, as long as it's clean water. Use of towels when you clean or you dry your hand with disposable towels. It is important for you just to pat. So pat means you just touch without rubbing. Okay, if you're rubbing it, it would makes your skin what we call this has a micro trauma. So there would be a skin excoriation, and there would be some bacteria colonizing on the skin, and there would be possible spread of blood-borne viruses as well as other microorganisms. So pat with your dry towels rather than rub it. All right, if you rub it, it would induce more skin excoriation. Okay, and the number three, the third one, hand drying. So when you dry your hand using a machine, is a critical factor because it determines the level of bacterial transfer associated with touch contact after hand cleansing. So hand drying sort of better than using the towels. All right, so not just saving the trees, but we also having a better result or outcomes. Okay, for the hands. All right, let's move on. Right, bacteria on hands. Looking at this diagram, it says that 1,000 uh, bacteria, resident bacteria per centimeter square on your hands. Okay, that's a lot of bacteria, and bacteria usually can stay alive on your hands for up to 3 hours, and your bacteria may grow best at 37 degrees Celsius temperature. And this diagram shows you how your hands can be a great source of infection to your body. Okay, and to other people as well. So 80% of illness causing germs are spread by hands. So just take that into your um, knowledge and apply. Okay, 80% of illness causing germs are spread by hands. So wash your hands, make sure your hands are clean all the time, not just when handling patients or doing any clinical work, but as part of your daily life as well. Right, so let's look at the hand hygiene products available. So I'm not gonna review the brands, but we're looking at the substance or agents that are available to be used as the cleaning agents. Okay, the first one is water, of course. The second one is soap, which is non-antimicrobial. Number three is alcohols. Number four is chlorhexidine. Number five, fluoroxenol, hexachlorophene, iodine and iodophores, quaternary ammonium compounds, and triclosan. If you look at all these substances, not all of them would be available in a single product. Okay, every product would have one of these agent as an cleaning agent or as an antibacterial agent. So the most common one that you probably know is alcohol that we use as a hand rub agent. We use also chlorhexidine in most of the hand washing soap, and the rest are not that common. But you could find triclosan in the toothpaste as well sometimes. You could find quaternary ammonium compounds in many products too. So these all agents are actually quite effective, but if you ask which one is the most effective, it's actually chlorhexidine. Um, because cloxidine has better side effects or after use. Okay, alcohol, if you use a lot, it can dries up your skin and then could cause micro trauma. For chlorhexidine, it has a better sensitivity, but the usage of chlorhexidine on your hands all the time could stain or could cause some discoloration too. All right, so these are the hand hygiene products that can be used. Agent in the hand hygiene products. Okay. All right, so let's look at the three different sanitizing products or hand hygiene products. The first one is hand wash, which is on your left. It can use any antimicrobial agent containing soap. So it should be sufficient for you to wash your hand with water. Okay. For the hand sanitizer, normally we would suggest the alcohol content should have at least or the range of 60 to 80% of alcohol, which will give the most effective against the bacteria and viruses, with higher concentration being less potent. So if it is more than 80%, it would become less potent. Okay, and ethanol has been said to have a greater activity against viruses compared to isopropanol, which being used in some hand sanitizer. And the third one is surgical hand scrub, which is a scrub agent they use when they are going for surgical procedures in the operating theaters or in the surgical room. So they for the surgical hand scrub, the most common one used is chlorhexidine 4%, because it can actually have an effective bacterial count reduction. Okay, some products use povidone iodine, but chlorhexidine shown to be more effective. Okay, so these are the criteria for the selection of hand hygiene products. Okay, so from the agents that I presented just now, you can see how they compare these agents towards the types of microorganisms. You can see the gram-positive bacteria, gram-negative viruses, envelope, non-envelope, mycobacteria, fungi, and spores. Okay, so for this matter, you can see the difference, the effectiveness against certain type of microorganisms. Okay. All right. So let's move on to the technique. All right. So we have, you probably heard of 7 steps technique. Okay, that's correct. But now here, I'm just gonna show you an 8 steps technique, which is almost similar to the 7 steps technique. Okay. So the first one is rub palms together. And then number 2, interlace fingers and rub hands together. Number 3, rub the back of your both hands, okay, interchange with each other. Number 4, rub the base of thumbs in a rotating manner. Number 5, interlock fingers and rub the back of the fingers and of the both hands. Then you rub fingertips on the palm of both hands. 7, rub both wrists in a rotating manner, and then lastly, rinse and dry thoroughly. This is using hand wash technique. Okay, this is a hand wash technique using soap and water. Okay. Okay, so for WHO, they have come up with this posters, which you can find everywhere, for the hand rub and hand wash. Remember, hand rub using gel or alcohol gel that no need washing with water afterwards. It will dries up by itself. Whereas hand wash, you are using soap and water, which you need to dry afterwards. Okay. All right. Just showing you after you have washed your hand, you are going to wear gloves, and this is just indicates the glove type of glove that you're gonna wear after washing hands. This is particularly you wash your hand before UC patients, okay? Because after you wash your hands, you're gonna put on your gloves. So this is just to show you the type of gloves that you're gonna put on afterwards, all right? Okay, I just would like to get you to watch all these videos that are available in this MOOC. Please do watch the videos. I'm not gonna show it here. It takes a while. So please do watch these 3 videos in our MOOC folder, in this unit folder, okay? Thank you for watching and we'll meet again for the next topic. Thank you.